Let's break it down side by side so you can clearly see the differences between Medicare Supplement and Medicare Advantage. Hey guys, welcome back to the channel. My name's Ethan Sholem and I'm the VP of Senior Star Insurance Group. If you're new here, we help people navigate through all the confusing Medicare decisions and cut through the confusion to make sure that they end up with the best insurance plan for their specific needs. Today, we're going to be breaking down one of the biggest Medicare decisions that people have: Medicare Supplement versus Medicare Advantage. If you're trying to figure out which one is right for you, or maybe you don't even know the difference between the two different pathways, then stick around because we're going to be breaking it down in plain English so you can make the best decisions for you and your healthcare and your wallet. All right, let's get into it. So first off, why do you even need a secondary plan? Well, when you turn 65, you get Original Medicare, which is made up of two parts. Part A for your hospital and your inpatient insurance, and then Part B for your outpatient medical insurance. Now, Medicare covers a lot, but it doesn't cover everything, and this is where people can get into some serious financial trouble. By just having Part A and B without a secondary plan, you're exposed to high hospital deductibles, which eventually become a daily occurrence. And then on the outpatient side of things, you would owe 20% for everything you do. Original Medicare also doesn't cover your prescription drugs. So what's the solution? Well, you have two ways to cover these costs. The first solution is a Medicare Supplement plan, also known as a Medigap plan. Medigap plans work alongside Original Medicare to cover those high deductibles and that 20% coinsurance on your outpatient care. You also would then have to add a standalone drug plan to cover your medications. So you would have 3 separate cards and 3 separate premiums to pay. The second option is a Medicare Advantage plan, which is also known as Part C of Medicare. This plan actually replaces Original Medicare with a private insurance company, so that private company takes over for Original Medicare. You would only have one card that you need to take to the doctor and the pharmacy, which would have the private insurance company's name on it, and you're likely to only have one monthly premium, which would be to Medicare. Let's go over both and see which one makes more sense for you. All right, first up, Medicare Supplement plans, also known as the Medigap plans. Think of Medigap like a safety net. Medicare is still your primary insurance, but the supplement plan comes in and fills those gaps, so you're not left paying those high deductibles or that unlimited 20% coinsurance on your outpatient care. Now, there are two main options when choosing a Medigap plan. These are known as Medigap Plan G and Medigap Plan N. No matter which one you go with, Plan G or N, those hospital deductibles disappear, including those daily ones. You're likely to never see another hospital bill again. You also get up to 100 days in a skilled nursing facility completely covered. Now, on the outpatient side of things is where Plan G and Plan N differ, but they're both still great plans. Plan G covers everything once you get past the annual Part D deductible, which in 2025 is $257. This means that you pay that small yearly deductible and that 20% coinsurance disappears for the rest of the year. Plan N is very similar, but you will have up to $20 copays at doctor visits, $50 copays in the emergency room, and it doesn't cover a very rare fee called an excess charge. These Medigap plans, both G and N, are standardized, meaning that a Plan G with one insurance company is the same exact Plan G with another company. The brand name doesn't matter because you will get the same exact coverage, and since Original Medicare is your primary insurance, you will get the same access to the doctors. You can go to any doctor or hospital that takes Medicare. No networks, no referrals, no pre-authorizations. If a doctor says you need something and Medicare covers it, your supplement plan picks up the rest of the costs, no questions asked. And I mentioned this before, but I really want to get this point across. Coverage is standardized. A Plan G from one company is the same exact Plan G from another. The only difference is the monthly premium. Now let's talk about something really important when speaking about Medigap plans: medical underwriting. When you first enroll in Medicare Part B, you have a 6-month window to get into Medigap without answering any health questions. But after that window closes, insurance companies can ask you about your health, and they can either deny you coverage or they can raise your rates on a monthly basis if you have certain medical conditions. So if a Medigap plan sounds like the right fit for you, do not miss that open enrollment window. If you want to learn more about which Medigap plan is right for you, then I recommend you watch my full Medicare Supplement breakdown. We go over how to choose the right plan and how to choose the right insurance company. These plans, they sound pretty good, right? Well, there's another option which may suit you better, and that's a Medicare Advantage plan. Now, Medicare Advantage, also known as Part C, works completely differently than a Medigap plan. Instead of Medicare being your primary insurance, a private insurance company completely takes over your coverage. They bundle Parts A, Parts B, and Parts D into one plan, which means that you're going to be showing this private insurance company's card at the hospital, the doctor's office, and the pharmacy. These Advantage plans offer $0 premium plans and will help pay your costs both inpatient and outpatient. They come with built-in prescription drug coverage, and they also include extra benefits like dental, vision, gym memberships, and over-the-counter allowances to help you with items like vitamins. But there's a trade-off. You can't just go to any doctor. You need to pay attention to the plan's doctor network. Some plans allow you to go out of network, but at a higher cost. So either way, you have to make sure your doctor takes the plan that you're thinking about. Medicare Advantage plans can require pre-approvals before you can get certain tests or procedures. There are also copays and coinsurances for most services. Your copays will contribute to a maximum out-of-pocket cost, which is a yearly limit on what you'll pay before the plan takes over 100% of your costs. So there is a safety net in these plans. So while Advantage plans are more budget-friendly upfront, you will need to be comfortable with the potential costs and potential restrictions that come with them. But there are some very, very strong extra benefits that make these plans really good. If you want to learn about how to choose the right Medicare Advantage plan for you, then watch my video titled 4 Simple Steps to Choose Your Medicare Advantage Plan. So which pathway is right for you? Let's break it down side by side so you can clearly see the differences between Medicare Supplement and Medicare Advantage. Your primary coverage. Medigap works with Original Medicare as your primary, where the Advantage plan replaces Original Medicare with a private plan. Monthly premium. Medigap has a higher monthly premium, where Medicare Advantage plans often have lower premiums, oftentimes even as low as $0 per month. Doctor access. Medigap lets you see any doctor or hospital that accepts Medicare. There are no networks, but on the Medicare Advantage side of things, the plans have doctor networks. You either need to stay in network or you're going to be paying more out of network. Referrals and pre-approvals. Medigap has no referrals and no prior authorizations, so you will have extreme freedom. Advantage plans, they can require referrals and approvals before certain procedures. Out-of-pocket costs. Medigap has predictable costs. You will be paying that extra monthly premium for the trade-offs of knowing your costs are fixed. Once you meet your small annual deductible, you're pretty much done for the year. On the flip side, Advantage plans have copays for most services, which means there are more variables. Prescription drug coverage. In a Medigap plan, you'll need to purchase a separate standalone Part D drug plan. But most Medicare Advantage plans include drug coverage at no additional costs. Extra benefits. Medigap is purely medical. There are no real extras, but Advantage plans often include perks like dental, vision, hearing, gym memberships, and even over-the-counter allowances to help you with items like vitamins. Underwriting and enrollment rules. Medigap has no health questions if you enroll during your first 6 months while you're on Part B of Medicare. But after that 6-month window, you could be denied coverage or charged more on a monthly basis based on your health. Advantage plans will never ask you questions about your health even if you enroll at a later date. Are you still not sure which plan is right for you? Well, that's what we're here for. At Senior Star Insurance Group, we do all the comparisons for you and with you. We check your doctors, your prescriptions, and your benefits to make sure that you're on the best plan for you. Call us today and click on the link in the description to download our free Medicare plan comparison checklist. This will help you decide which pathway is right for you. Don't forget to like, subscribe, and comment. Thank you guys for watching, and I hope to see you in the next video.